Good afternoon, and today I'm very excited to be talking with two experts in the field of alternative dentistry. And we're going to be exploring how dentistry plays a vital role in our overall health, amongst other things. We did invite questions. This is recorded, so we did invite questions beforehand, and we've had a great response to that. So without further ado, I'd love to introduce you to Dr. Marina Carew, who is a retired dentist with many years' experience on both sides of the fence, both holistic and, dare I say, conventional. And Dr. John Roberts, who has over 40 years of practical experience as a holistic dentist, as an integrative health doctor, and has travelled extensively as a lecturer, organizer, and delegate in Europe, North and South America, and Mauritius. So welcome to you both. It's fantastic to have you here. Very, very exciting. And I'm going to shut up and hand over to you guys.
Thank you for having us.
Yeah, Marina, ladies first.
Well, I'll tell you a little bit about me. I was a conventional dentist. I qualified in 1986 from the London Hospital, and sad to say now, I thought I knew it all, but because that's what they teach you at dental school. You go into dental school and the first thing they say to you is, you lot are the creme de la creme. You're the top 5%. Did you get that, John?
Never heard that.
Oh, we were told that at the London. And so you then believe that everything that your teachers are telling you, your lecturers are telling you, is just gospel. So I came out, thought I knew it all, putting amalgams in, using fluoride. I'm ashamed to say I gave my eldest daughter fluoride drops because I thought it was the right thing to do. And, I got started in holistic dentistry. My mum's German, and she used to read lots of German magazines and say to me, do you know what? They're writing in there that mercury is really bad for you. And I would say to her, can't be. Why would they teach us that at dental school? We've got the best professors, so what? Can't be. Absolute rubbish. And it took a car accident, it'd be this time 27 years ago, when my youngest was 3 weeks old, for me to have to give up work. Everybody thought I'd never get back to work, but they didn't realise I'm a stubborn old cow, and I did. And I went on some courses that I would never have done otherwise. Started off with braces because I didn't really get it at college, and I used to refer everybody out. And I went on a course by a little Texan guy, Skip, bless him, who just blew my mind that whole weekend. And I came away thinking, I can't just refer patients to the orthodontist anymore. I've got to actually look at them and not take teeth out and see if we can, make their jaws bigger. And it was just a complete revelation to me. And then I met some other dentists on the course who said, you're not still putting amalgam in, are you? And I was like, yes. And they then got me to go on some other courses, and I met Dietrich Klinghardt, met John along the way. And that was the start of my holistic career. And it took me 7 months to recover and get back to work. And when I got back, I thought there's no way I can put another amalgam in. So I didn't. So I haven't put an amalgam in for 27 years. Sadly, I was very mercury toxic. But, it's all been a lesson for me. And now I'm at a place where I love what I do. And I think it's about educating and empowering patients.
Okay, that's great. And I say, Marina and I have shared this fantastic journey for years and years, and we're quite soulmates. We'll often talk when I do long drives and everything, and we share ideas. And it's nice to say that probably we won't agree on everything today. And that's not a bad thing, because dentistry will agree there's not one way to do things. And the more someone says, this is how you should do it, they're probably wrong. Having said that, my journey is I qualified from Leeds University 1981. My holistic journey started when I set up my own practice in sunny Rochdale in 1987. I'm fortunate I've never had an aha moment. It was just listening and talking to patients. I was introduced to homeopathy way before that when I was working in Huddersfield. And if I didn't know something, I didn't dismiss it. And the problem is, people don't know, and then they'll say, well, it can't be true because I don't know it, rather than I'll go away and find out about it. You know, you have the situation, does mercury come off fillings? Well, you either know it does, because every single bit of science says it does, or you don't know, in which you'll deny it. How much and how it affects you is slightly different. But the bottom line is that's a fact. And we'll cover all of these going forwards. Anyway, I was fortunate. You just get a reputation for seeing great people, and you learn from great people, you know, and sometimes the challenging patients are great. But my practice slowly grew and developed, you know, things about mercury fillings and toxicity of materials, which we'll cover. A whole thing about root canals, which is still ongoing, and there is so much stupidity linked with that.
Agreed.
Marina and I grew up and started doing non-extraction orthodontics, early orthodontics, not waiting for all the teeth to get in a jumble and then take a few out and shuffle them around like, you know, some picture. But we know where the teeth should be for health. So everything we've done has been health orientated. We sometimes can't achieve that. And I think one of the titles we wanted for this talk was Dentistry is a Compromise. If we're doing dentistry, we're compromised. But you know what? We'll make the best of the compromise we can. And I used to say 35 years ago, we're going to give you 28 teeth in a straight line, all fitting together the way nature intended. That was wonderful. But in reality, not sure where we're going to get there. But we'll get you as close as we can. And hopefully the body's own ability to, how can I say, to adapt. This phrase hormesis comes in. We'll get you as close as we can, and the body can make good the rest. Because everything we do from the moment we're born to the day we die has been and will be influenced by the dental care someone's received. Yeah, I've done lots of things along the way. People like me, people don't like me. I'm really just speaking my truth at this moment in time. Happy to be associated with the PHA. So we got some questions. They're the burning topic, but I'd like to say right at the beginning, if some of these topics and questions you like, it isn't about Marina and I wanting to see patients. That's not the issue. You know, I'm becoming old, grey and grumpy, as you can see.
I am grey and grumpy.
You are. But the bottom line is, we want you to talk to your dental provider, be it your dentist, your hygiene therapist, point them in the direction of the PHA to begin with. We will then set up a directory, or you will, Lisa, set up a directory for like-minded, health-orientated dental professionals, hygiene therapists, dentists, even the nurses. And using the PHA as a group, a focus group, we will start to regrow holistic dentistry. There is the Homeopathic Dental Association. There is the Dental Association for how the teeth fit together. There has been mercury-free organizations before the Americans took it all back again. And there's way out weird and wacky. But you know what? If we have a focus and then we pour in as many dentists as we can to that group, then it gives a wider choice for the PHA to help their members. And that's what this is all about, not come and see me or come and see Marina.
Well, you can't see me anyway. I don't practice anymore. So
the other thing is, and I perhaps should say this, because I'm still on the dental register, because I want to keep my license going forwards, this is one of those disclaimers, you know, like you get from Virgin or, you know, any of these other insurance people. So today, I am choosing to speak as a registered and qualified dental practitioner. The information you hear from me today is for general education and information purposes only, and it should not be relied upon as personal dental and medical advice. Please consult your dentist or doctor before following any advice given during this webinar, as your particular case may be different to those that we discuss. Now, I also have another degree in integrative medicine. I have separate insurance. So if I drift, and go into the weird and wacky, wonderful realms, teeth and meridians, teeth and energy, that is done on my separate indemnity. Marina has the freedom to perhaps talk a little bit more liberally, because she is no longer practicing as a dentist. And
yes, but we still have to have a disclaimer from me, because nothing I can say could be taken as medical or dental advice.
Yeah, so we're sort of yin and yang on a lot of these subjects, but if the message gets out there and we can grow and flourish with the PHA, that's what we're looking for.
That's amazing. John, just before we go into the questions, I'd just like to admire the unicorn horn on top of it.
I realise that. Yeah, I've been trying to do. Well, it's a lava lamp. There you go. It's balanced on my
Brilliant.
feet. Yeah, so I think that will start to work as we go through the talk. Yeah.
Fabulous. So, to the questions.
Let's just have the one that's been around the longest, because as soon as mercury fillings were used, from about 1820, there's always been a source of contention. And right off the bat, the facts are mercury comes off your fillings all the time, and it's made worse when you eat, you have hot drinks, you brush your teeth, you grind your teeth, and mercury comes off your filling in one of three ways. It's either going to evaporate off, and you can chew gum, blow out, and you can, with specific machines, measure the mercury vapor. It wears away, so chunks of, very small chunks, abrade, get into your stomach, where it's converted by the bacteria in your stomach to a more harmful form of methyl mercury. And it also dissolves through electrical issues. So if you touch several fillings, you'll see an electrical current. It's literally rusting. It is releasing mercury, silver, tin, zinc, and copper into your system. That gets absorbed in the saliva. It gets absorbed straight through your tissues. So mercury coming off your fillings is now irrefutable. No one can tell you it's wrong. The biological effects of that mercury coming off is the controversial thing. My father died at 86, but he still had some amalgams in because I had to have a reason to replace them. Equally, people are coming in with severe health issues, and they are choosing, as part of their overall wellness journey, to have their mercury fillings taken out carefully and safely, which is what we have always tried to do. But we can't promise you'll take your mercury fillings out, you're going to get better, because it's not the mercury that's in your fillings that is causing your problem. It's the mercury that's in your fillings that's going to be released and then plug up or harm your biological process. So that is why we don't always jump up and down and say you need your mercury fillings out, but perhaps there's some other more important health issues that you need to address first. Marina, and I applaud her, is very big on perhaps even leaving them until you've got your detox protocols, you've got your system working to flush it out, because sometimes you can actually, and I'm going to say I don't think I have, but who knows, maybe cause some harm. Equally, as a practicing dentist, to electively start taking mercury fillings out, you also then run the risk of perhaps harming a tooth, killing a tooth, needing a root canal. So you've got to have the patient on board the real reasons why you're taking fillings out. But anyone who says mercury isn't coming off, they're telling a lie. It's when you start mixing the mercury with other metals in your mouth, and dare I say, metal implants, metal crowns. We used to make a lot of metal dentures. They're generally not made anymore, but I don't know. I'm out of touch with some things. Different metals increase the corrosion, increase your risk of mercury. So I'm going to hand over to Marina. What are your thoughts on leaving or losing mercury fillings?
Well, when I was in practice, I did take them out for patients who came in and asked for them to be taken out. Because I was on the NHS for a long time, I had a lot of my patients carried on seeing me, and they had amalgams in their mouths, and I never ever said to them, you need them taking out. I told them I would never ever put another one in, and if they wanted to take them out, I was absolutely made sure that they understood all the consequences that could happen, because I don't think people just think, oh, it's really easy, go and have my amalgams drilled out, and as long as it's done safely, it's fine. But the issues are, if you have an amalgam taken out, if you have any filling taken out, there's always a risk that the nerve might die. That could be because it's close to the nerve, or it could be because the bite isn't then right, you know, and people, sometimes nerves die because of the trauma when you're biting on them too hard. And so then you have to think, well, if the nerve in my tooth dies, what do I do then? Do I have a root canal or do I have an extraction? Now, to my mind, I personally wouldn't have a root canal, but that doesn't mean to say I think they should all be taken out, but we'll talk about that later. So when I had one, I had all my fillings replaced probably about 25 years ago. And I had them done with a really good dentist, but the problem is that white fillings then had a lot of BPAs in them, which we didn't know at the time, or, you know, maybe I didn't know. And I've subsequently lost 3 of the teeth that I had the amalgams replaced because I didn't want to have root canals. So now I'm looking at having a zirconium implant. So I would say to people, just be really aware. You need to make sure that the dentist who is doing it, if you really want your amalgams taken out, have it done. Make sure you go and see a dentist who is trained properly to do it, using the correct protocols to protect you and protect themselves. And make sure that you are detoxing properly, because there's a lot of mercury vapor given off when you have your amalgams taken out. Even when they use all the suction and everything, that helps an awful lot. But there are risks, and if the nerve dies, you then have to decide, what am I going to do? Am I going to have a root canal, or am I going to have an extraction? If I have an extraction, what do I do with the gap? Do I leave it? And I've heard people say, oh, it's just vanity. Not always, because sometimes that gap could lead to the teeth either side tipping inwards, or the opposite tooth overgrowing and interfering with your bite. And bite has an effect on your body as well, your posture, and your vagus nerve, TMJ. So everything has a consequence. So don't just think it's easy to go and have all your amalgams taken out and that's what you must do. I think you need to find a dentist who is going to explain it to you. I know John will. He would explain every step of the way and everything that could possibly go wrong, because sometimes nerves die and we don't know why they die. They just do. So I think it's important people know that.
Sorry, you touched briefly then on having a proper detox protocol, and I don't want to, that's a huge subject in itself. I don't want to, you know, sort of take over the conversation with that, but have you got any sort of high level insights into that detoxing properly?
Well, I used to follow a lot of Dr. Klinghart's work, and it worked for many of my patients. You know, I had patients who they'd take chlorella, and I'd give them charcoal just before the appointment. I'd give them chlorella to chew as soon as I'd taken the amalgams out. And I also followed his protocol where, you know, they'd have a separate nasal breathing air and everything. But I found that a lot of patients did do really well, but there were some patients that didn't feel any difference. And I was one of the people that never felt any different. I didn't feel any better, I didn't feel any worse. So I was just the same. So for years, I wasn't really, I looked at several detox protocols and everybody's different. So what works for one patient might not work for another. And then 3 years ago, I was introduced to some detox drops, and I really did not want to take them. I was not interested in them because I thought, I've been there, got that, got the T-shirt. But my friend nagged me so much that I started to take them, and I couldn't believe the changes in me, and it's completely changed my life. And there are lots of patients it has changed their lives, and which is why these particular drops you can take while you've got your amalgams in, which is why I'm now beginning to think more, well, maybe we need to get the patients really healthy as possible before we start taking their amalgams out. Now, my mother, like John's talking about his dad, my mum's 86. She has 2 root canals. She has a mouthful of amalgams, and I mean a mouthful of amalgams. And again, like John, you know, there was no reason to take them out. She's 86. She lives on her own. She lives in sheltered accommodation, but she gets a bus into Cambridge. She does her own shopping. The only time that she's not been well is since she's had the intervention, because she believed that she needed to have them because she's vulnerable. So she's had 4 of them, and she's still, you know, pretty much going strong. But when I think about amalgams, I think, well, my mum, you know, has got a mouthful. But the difference is she was brought up at a time, you know, even in the times when John and I were born, the food was better, it was better quality, there were less toxins around. And now everybody's been bombarded with thousands and thousands of toxins, and some of the worst ones, all the PFAs, you get in plastic everything, you know, plastic food coverings. And when I was a kid, you go to the greengrocers and they put it all in a brown paper bag. So, you know, I think detoxing for me is the most vital thing for everyone. And I, you know, I personally would think people should do that first before they even think about having any dentistry done that is not absolutely necessary to get you out of pain or get you out of trouble. That's just my personal opinion.
Yeah, I think my view is slightly different, and the nice thing is I'm not drilling out mercury fillings, so someone else gets that proportion. I think that, you know, the whole point is it's individuality. It's what's appropriate for you where you are at this moment in life. Now, I can never see a justifiable reason to put a mercury filling in. I'm probably,
absolutely,
you know, 30 plus years of never having put an amalgam in and been mercury free for that period of time in my own mouth, probably a bit longer. You've got to work harder at keeping a mercury-free mouth, because you know what? Amalgams, if you were going to be sent to Mars and you couldn't find a dentist, probably amalgams will last longer than anything else. It just might slowly poison you in the process of getting to Mars and back again. So taking mercury fillings out when it's appropriate. So whenever you take a filling out, the same protocol is used for everyone. Cover the hair, the eyes, the clothes. A separate air supply is easily done. And if anyone wants to contact me, how can they make it? You know, for a couple of quid, you can sort it out, because at the end of the day, it's the mercury vapor that's being released whilst you're drilling that is breathed in, and 80% plus goes straight into the body. Again, if I say things like that, I'll give you your science, you argue your science against my science, and, you know, tell me I'm wrong. But 80% plus of the air you breathe in, you'll absorb the mercury. So in fact, separate air supply. Yes, rubber dam, high volume water, special drilling. And the Americans, which I used to teach the course for years and years ago, came up with this SMART protocol, which was safe mercury amalgam removal. But then they sort of took control, and you have to spend $500 and do an exam and go to a meeting to become a smart dentist. So probably with the cooperation of PHA and maybe just being a mischievous Liverpudlian, we'll be smarter in the UK, but without having to go through all the rigmarole of what the Americans choose to dictate us from. So that is going to be doing. And again, I can work with dentists how to become smarter, but not have to follow all the American rules, because whatever you do, it actually is the intent that you do it with that is more important, rather than, well, I can see, sorry about this, guys, to see neurotic middle-aged women who want their amalgams out, and we can make a quick money here. Because unless the dentist is protecting themselves and their nurse, really they're doing it for perhaps different reasons. And so I wear a silly mask, which is why I'm as sane and normal as I am, because I didn't want to be mercury toxic from when I started taking them out. I use a product, and if it's okay, you can bleep me out at this point. It's a zeolite clay. It's called ToxiPrevent. You can look it up. But there is actual scientific research showing it is preferentially binding mercury. So again, I give a mouthwash before, I get them to rinse out their mouth with it afterwards, and then I give them some lozenges to suck for the next few days. And so that, I believe, will cover me, though on that bit I don't have the science, but it's the best material I have found. And again, you buy it online, nothing to do with me, they have their own protocols, but it's something to protect you while you're doing it. The other thing to remember is you can have a filling taken out and you suddenly say, oh, I felt lousy after that. Sometimes That is because you're then changing the electricity that's traveling around your mouth. You're taking out like a battery, and then the battery has to reset itself. So it's interesting, more and more dentists, and I was talking to one over the weekend, we're now going back to touching all the fillings to see how much electricity is coming off. And that in itself adds another dimension to taking mercury fillings out, because you're taking electricity out from your mouth. The currents that are running between your teeth are a magnitude of thousands of times higher than it's working on your brain. So again, not making any promises about health, but taking the metal out and therefore the electricity out your mouth can be a win-win situation. And perhaps this ties in with, I know you've talked to Glyn Hughes about the EMFs and all of this, which is becoming an incredible problem. And yeah, hands up, 5G, not for me, but we have to live with it. And getting your metal fillings out, they are sensors, they are receptors for all these unknown, unseen, unqualified electrical issues that we're now all having. So metal-free mouth from that perspective is probably a good idea. There is no place for mercury fillings in this modern world, and a lot of Europe don't even teach mercury fillings anymore. And you have these foreign dentists coming in and wanting to retrain how to put mercury fillings in. How, can't use the word backward, but something word similar to that, are we? You know, states in America, you can't do them in women of childbearing age. Well, that's a woman up to the age of what, 45 plus? It just doesn't make sense. It brought dentistry out of the dark ages. It brought dentistry out of the barber shop, but really put it as in the annals of history and let's do something better. But again, really the problem is, why are we putting mercury fillings in our mouths in the first place? And so that opens up what, again, Marina and I wanted to talk about more than anything is, what are the root causes of dentistry rather than what chemical solution are we going to have? Because at the end of the day, a mercury filling is chemistry between mercury, silver, tin, zinc, and copper. We can put plastics in. That's a chemical intervention. What is it that we're having to do to fix teeth in the first place? And so, Marina, what's your thoughts on why we have dentistry in the first place?
Diet.
Over you. Yeah,
I think it's mostly diet, and I think these days toxins as well. I think there's a lot of children getting decay because of the toxins that they are subjected to in the womb from the mother. So there's research coming out from various universities about PFAs they believe affecting the development of the enamel in utero, but they don't quite know how that happens. They need to do more research. And there's also research that shows impacted wisdom teeth have lead and cadmium generally in the bone and in the tooth. So there's lots of, you know, I do think toxins play a big part. I think toxins, airway, I think oral hygiene to a certain extent. But I think it's mostly diet and toxins. And of course, if you mouth breathe, you have a dry mouth and you need the saliva to help buffer all the acids in the mouth.
Yeah, so I think, you know, we go back to what you read about on the internet, and it's full of stuff which quite a lot of it I think is absolute bunkum. You can regrow your teeth. Well, I
really
on this, you can't regrow your teeth. You can harden them and maybe stop them dissolving away as much. But you know, when you see these pictures about regrowing teeth and everything, I don't think in the next 5 to 10 years we're going to be able to do that. And I think there's a lot of misinformation to sell products. There you go. Why have we got this level of decay? Why have we got this level of gum disease? Well, if we're a civilized society, why did only 5% of the Romans have gum disease, and we've got 33% have the bone-destroying periodontal disease? It doesn't make sense. So it is our environment now that is creating these issues. A child shouldn't get decay. And going back to my dental school days, you've got to have fermentable sugars, whatever it is, including too much fruit. You've got to have the bacteria, and you've got to have the environment. Well, the environment is the tooth and the gums. The bacteria is something we can talk about in a minute, which is Have we got good bugs? Have we got bad bugs? And then the fermentable sugars. And we now want to have a world where we want to eat and do all the things our friends do, but that can be generally harmful for our teeth. We never used to graze on food. We never gave kids a snack when they came in from school and a meal afterwards, and a lunchtime, not a lunchtime, a morning break, an afternoon break. We're continually eating perhaps one meal a day, maybe 2 meals a day max. So we want to live a modern lifestyle, and something we'll touch upon, I'm sure, is, and we want to then say, okay, we don't want to use fluoride to harden the teeth. We'll use other materials. Again, it's a chemical solution to actually what we're doing wrong in the first place. And if we change our environment, change what we're putting on our teeth, that's a much better way. And dentists should be going back to talking about prevention. And as Marina says, not breathing through the mouth, putting the right kind of foods in the mouth. There's a whole thing about probiotics at the moment. I was at a meeting on Friday, and they're saying there isn't enough research to start to recommend giving people probiotics. But there wasn't enough research to say mercury fillings were harmful when I first started taking them out 30, 40 years ago. Are we going to wait for the research to catch up, or are we going to say, let's work on observational medicine? Because that's where research comes from. You want to understand more. The whole thing about oil pulling. Half the people say oil pulling doesn't work. And yet there's so many people oil pulling, and it does seem to get magical results. And perhaps the wrong word, magical there. You see clinical benefits of oil pulling, but it isn't the be all and end all. And so everything is a balance. But let's get the kids off the sugars. Let's get the kids eating less, a couple of times a day, good, wholesome, healthy foods. And Marina's right. The plastics in our everyday life are horrendous, and we're not seeing it. There's favorite drinks that come in red cans. They've been shown to have plastics in for the past 20 years. People are consuming these plastics, are poisoning us slowly. What do I want to say? Even the white fillings we have chemicals in, and we do our best to use bis GMA free fillings. But as Marina has alluded to, those fillings don't quite last as long as the mercury fillings, and they wear a lot more. And therefore, you're going to be having that filling perhaps redone more frequently than mercury fillings. Equally, dentists are over keen to replace the fillings the moment they stain a little bit. You're shown how to look after your teeth. Fillings will last and last and last. They might not look pretty. And then we get into the whole realm of everyone wants their teeth to look pretty rather than their teeth to function the way nature and biology wanted them. So within that, Marina, you take over talking.
Well, I think you said most of it. I agree with the diet and the drinks, all the fizzy drinks. And yeah, I just think we've really got to go back to eating whole foods, getting rid of the ultra processed foods. It's just changing your way of life, really. If you're really serious about your dental health and your general health, you have to overhaul your diet for most people. That is, eat organic where you can. I understand it's not possible for everybody because it's quite expensive, but just changing your diet and avoiding as many ultra processed foods as you can and going back to whole foods. And there are groups on the internet, on Facebook, for ultra processed foods. They have recipes, and they talk about that there's apps you can get so you can see how much sugar's in something. I think there's how much sugar, but anyway, ultra processed foods. And then there's Chris Van Tulliken's written a book. So has Robert Lustig. I think Robert Lustig's book's called Metabolical. So they're all really interesting things because they affect your body's chemistry and your immune system. And it's your immune system that you need to keep strong if you want a healthy body and healthy teeth. Yeah. That's it, and the other thing is drinking clean water. I think that's one of my biggest things. Clean water, clean air, if you can. You've got to stop using candles and things at home that have got chemicals in them. they're just affecting our bodies in so many ways. And I think tooth decay is just another way they're affected.
And I think that's the difficulty, is we want to live a lifestyle that is causing all this harm, such as you say, candles. Our kids want to eat, oh, grandma will treat the kids to this sweet and that sweet. But then we want to deal with it differently. Oh, we don't want fluoride, we don't want this, we don't want the other, we only want to use certain types of specific hydroxyapatite toothpaste. But you're not doing the right thing. Why are the kids getting decay in the first place? And swapping chemicals, fluoride for hydroxyapatite, is really putting a sticking plaster once the wound has happened. And these sticking plasters aren't as good as each other. And that's a really thorny question. I don't know whether Marina and I are going to agree with this. I'll get kids coming in with a mouthful of decay, but mum saying, I don't want to use a fluoride toothpaste. Well, then please accept your kid is going to have some teeth taken out because they've got decay because of the lifestyle you lived. I am right here and now saying, I don't want fluoride in the water. I don't want fluoride drops. I don't want high fluoride varnishes put on kids' teeth. I've not done it for 35 plus years, but sometimes brushing a fluoride on and spitting it straight out hardens that tooth whilst you change the foods that you're putting in, the fermentable sugars, and how you clean those teeth so you can keep the teeth. As soon as you change the habits and create good habits, whether it's, in 2 weeks, 66 days, they say to change a habit, and you get the child liking and wanting to eat good foods, then maybe you can go back. But you've also got to be taught how to clean teeth. And that's a big thing. We buy an electric toothbrush, and there you go, give a 6-year-old kid an electric toothbrush. Well, they can't even dress themselves, never mind clean their teeth. And at 6 years old, they've got a tooth that should last them 94 years if they live to 100. What else do you charge to a child that's got to last 94 years? So as a parent, got to take responsibility. And I know you'll have, well, he won't let me clean the teeth. Clean the teeth in the garden. Just break that cycle of conflict that you have with the kids, rather than saying, well, I don't want to use a fluoride. The kid won't let me brush the teeth. I want to use this hydroxyapatite or whatever other toothpaste is on the market at the moment that I'm not convinced myself yet is as good a substitute as fluoride. But that's the compromise. What's your take on these toothpastes, Marina?
I'm not sure about hydroxyapatite toothpaste because I don't. A lot of them advertise nano hydroxyapatite, and that's the big word, nano. We'll have nano colloidal silver. There's a nano colloidal silver toothpaste, which I think is horrendous because you're killing off all the good bacteria. Because there's got to, as you said previously, there's got to be a balance. And with the hydroxyapatite, if you're using nano hydroxyapatite was banned in Europe. And there is something to do with the crystal sizes and crystal shapes. And if you shouldn't have a toothpaste that's got more than 10% nano hydroxyapatite. The worry about anything nano, like a nano mineral, that if you have too much of it, it can be genotoxic and it can actually damage the cells. And I think with hydroxyapatite, nano hydroxyapatite, certain crystals and too much of them can damage your kidney cells. So I'm still, the jury's out as far as I'm concerned on nano hydroxyapatite. Well, nano hydroxyapatite I just wouldn't go near, but hydroxyapatite I don't know, so I tend to steer away from it until I know there's more research on it.
I don't think there's been a good study comparing fluoride and hydroxyapatite or any of the others. And again, putting the scientific hat on, scientifically, we know that topical fluoride, brushing it on and brushing it off, seems to harden teeth. There was a great study just recently published in the Northwest, where you and I are based, Lisa, where they really were questioning the efficacy of putting fluoride in the water. And some wits much greater than me would say that putting fluoride in the water is like putting suntan oil in the water. It's a topical, it works topically, and therefore it's only brushed on and brushed off again. And putting fluoride in the water that gets absorbed into your body, your bones, your pineal gland, there's too many questions out there. Then teach someone how to brush their teeth properly, reduce the fermentable sugars, and get them living a wholesome life is much more beneficial than swapping this chemical for that chemical. Sorry, I interrupted you there, Lisa.
It is very difficult, isn't it? Because, you know, trying to buy wholesome food is not easy these days. Number one, people don't have the budget. Number two, the supermarkets are selling 90% processed rubbish. So, and it all comes back to convenience, doesn't it? We've been fed on this convenience thing for so long that it's huge. But, you know, I think the important thing to take from what you're saying is you can make changes. You may not be able to afford all of the organic stuff, but you can make changes, and it's changing lifestyle, isn't it?
It's hard work trying to be healthy.
Yeah, it is. It's hard and expensive.
Yeah, I agree.
You cannot buy some of this health you're looking for because you've got to change the convenience, you know. Going back to, you know, switch the Wi-Fi off at 10 o'clock. Oh, the kids won't like, you know, live in a healthier environment, which is really, we're here fixing an environment that's gone wrong. That's a reflection of the rest of the body. Because if you're getting teeth that is dissolving and going bad, and gum disease that is spilling bacteria in, then really don't try and buy a solution. Live the solution, I think, is much, much more important.
Yeah, no, absolutely.
Yeah.
I was just going to say, do either of you have a toothpaste that you would recommend? Because that was one of the questions that was coming through, and you know, it is difficult, isn't it?
The get out of jail question is the one you like the taste of, because I would say try a salt. You know, we'll eat a salt toothpaste. I hate it. You know, and then everyone says, "What about the salt you're taking in?" Well, there's another debate on do we get enough salt. My mum during the war used to use soot and salt, and she went to her grave with 60% of her teeth when she was 96. So, but then she didn't eat the rubbish foods that we eat these days. So
that's it, isn't it? That's it.
We didn't have the processed food when we were growing up, so.
And to put it another way, if I get a child come in and see me, 16 years old, got all their teeth in a straight line, no holes, you can clean your teeth with whatever you're using because you are in balance with you and your health.
Yeah.
But when you get a child who comes in and they're 8 years old and they've got 4 or 5 of their baby teeth gone bad and the adult teeth are starting to go bad, and they're saying, but we don't want to use this. Well, fine. But please accept your kids are going to have holes in their teeth unless you drastically change a couple of things. And you've got to not be afraid to have that blunt talking. And I think we've always been afraid, and we never want to offend someone. We are only here to help and heal and advise. Sometimes, you know, hard help is what is needed with some of these patients. And that's where you bring in the team. That's where, you know, the important people are the staff to give advice on brushing and cleaning and how you should do it. The hygiene therapist to really engage the kids and say, look, here's the balance. Yes, you can eat sweets, but please at a mealtime, not graze on them from the moment you leave the school gate till you have your tea at 5:30. You know, the advice is there, but we just want the convenience.
It's getting the parents, educating them, isn't it?
And grandma and granddad, and in this modern world where, you know, parents aren't together, feeding them nice foods that make them feel good because of the sugar addiction is actually a way of parents, I'm getting in trouble for this, coercing their kids into you like me because I'm giving them things that are naughty. And you've got a mother and father sort of competing to be nice to the kids, but really harming their health at the same time. It's a bit harsh, isn't it? Probably get in trouble.
I tell you what, my grandson is 2.5. I do not buy him any sweets. I do not buy him any chocolates. He gets cheese. We go into Waitrose and I buy him the cheese, the organic cheese things in packets, and he loves them because that is all he's allowed to have, and water, you know. And I don't, because I don't want him to have problems.
And so it is, choose the lifestyle you want and live your life according to that lifestyle. But don't try and buy it and fake it.
Yeah, I think the other thing that affects teeth and gum disease is stress. Stress is a big issue. And I think people get very stressed, and then it has a huge effect on your whole body, let alone your teeth. So I think people need to try and find a bit time to relax a bit more, not in front of the telly, because I think telly's not great. I don't have one. I haven't had one for 17 years, but I think it's giving off blue light all the time, the EMFs, and I think people should be out in nature more to get the fresh air. That's really important, and the sunlight. Get as much sunlight and grounding as possible. If you can go barefoot, go barefoot. All of those things beneficial to your health, and anything that's beneficial to your health will also be beneficial to your oral health.
Yeah, that's fantastic. I've been reading up recently about forest bathing.
Yeah,
So
what the Japanese call it, shiruku or something, isn't it?
And then my grandson's lucky enough to go to a forest nursery school, and he's out all day, and he comes back covered in mud, and it's wonderful. Yeah, wonderful. I just think, if I'd known about this, but I think I was too far in the matrix all those years ago when I had children.
So, and it's a nice thing to add on here is that we underestimate the effect of vitamin D on our whole general health. Let's start with vitamin D is not a vitamin; it's a hormone that we make in our skin from cholesterol and stuff like that. So first of all, I'm not sure about driving cholesterol levels through the floor for the sake of taking drugs, but vitamin D is made in our skin, and we have to have good quality sunlight. And vitamin D creates fluid flowing through the tooth. Again, this is a controversial subject, researched and then not taken up. Can you imagine a tree and it's got the branches and the leaves at the top? Fluid flows up the tree and takes all the nutrients out and keeps the tree alive. And then in the winter, it pulls all the nutrients back in, survives the winter. Vitamin D creates a fluid that flows through the root, up the nerve, into the tooth, and bathes the tooth. And that's where a lot of our minerals come to re-harden the teeth. And then it has the saliva to harden the outside bits. But if we don't have vitamin D, the fluid then flows through the tooth differently. It's a bit like a tree sucking in all the pollutions and taking it down to poison the root. So there's a lot of thought on vitamin D. There is massive research showing vitamin D levels with your sleep. And I'm looking in some of the practices I'll just be doing consultations in to do a free vitamin D test. It'll be free if you hit the correct level of vitamin D, which is 60 to 80, I think, nanomoles per deciliter. Do a simple pinprick test. It's free if you pass the test. But most people, I would suggest, are vitamin D deficient.
Agreed.
Hormone affects every aspect of our life, and dentistry is one place where we can see it. Sleeping is a time when we can experience it, but vitamin D for the whole of the body. And we were meant to be outdoors. Why did all these kings come along 40 years ago, coinciding with fluoride toothpaste and stuff? So we have the fluoride toothpaste to plaster the cracks in the tooth that really are there because it's happened because we're all indoors now. And even when we go out, you're putting suntan cream on the kids, so you're stopping the vitamin D from being created. Okay, I'm in Scotland, so I probably should take some more vitamin D, but we should all be finding an optimal level of vitamin D, because you know what? Chemical solution, substituting a hormone that we all need, but that's a great foundation. So as much as we're talking about detox, just getting the right stuff in. And I am a big believer, and more from my training in America 20 odd years ago. You need to test someone to see where they're at. Do a hair mineral analysis to see what your mercury levels or your lead levels are like. At least you got yourself on the map, and then you can take action. But people say, oh, I take vitamin D, I'm fine. Prove it to me. And if you prove it to me, you can have it for free. So, yeah, blood tests can run into hundreds, thousands of pounds. And that's what the functional medicine doctors are doing now. They're testing your body to see what's working, what isn't working. We see it very graphically in the mouth, where you've got gum disease, decay, poor sleep, poor function of the mouth. It's there for all to see. Anything to add, Marina? Shall we talk about gum disease now?
Well, I was going to say, what's the next question? But
well, one is mercury fillings. So we don't have to take them
done
out. When you take them out, you've got to go and see a smarter dentist and be aware that there's risk for taking mercury fillings out, and it isn't necessarily a panacea, because if you turn off the tap, one of the great guys, Murray Vimmer, used to say, taking out your fillings is like turning off the tap. You don't stand under the shower and dry. But I do think
no,
you have to.
you can get stuff to mop it up. So if
Yeah.
you have got very deep fillings and you cannot afford to have them taken out, that's my other big issue. There's a lot of people that feel, I've had people write to me and say, well, I've been told that I've got to have my amalgams taken out, otherwise I'll never get well. That is so wrong, because I think your psyche is really important. And if you think to yourself, I'm never going to get well because I can't afford to have my amalgams taken out, I think that's a really unfair thing to do to patients. So I think, there are other ways that you can. In an ideal world, yes, you wouldn't have any amalgam fillings at all. You'd have them taken out and everything would be fine. If you can't afford it, there are ways to mop up the mercury that comes out of your fillings. And, I can vouch for that. But like I said, it's best not to have them. But if you do have them and you can't afford to have them taken out, or you do not want to have them taken out, you can detox from it but you have to do it on a daily basis, because you're chewing and eating, but you're getting toxins in from the air and from the food you eat and the water you drink and the EMFs. So you've got to, I personally think we should all be gently detoxing every day anyway. But that way you can use the nutrition. You see, people put in loads and loads of take magnesium supplements, and magnesium is a really, really important mineral, because it's involved in over 300 chemical reactions in the body, and you can put it in, but mercury mercury sits in a lot of the receptor sites that is meant for magnesium. So if your receptor sites are full of mercury, then you're not going to be able to use the magnesium. So you need to get the mercury out so that the magnesium can get where it wants to be.
Yeah, detoxing every day, I think, is the most appropriate,
but it's got to be gentle.
I also agree. We're not going to disagree on this one.
John, I'm glad you mentioned the hair mineral testing, because we're going to do an interview with a guy in a couple of weeks. He's the mineral man on YouTube, and he's going to talk all about that. So it is a great way to see what you need to do in terms of detoxing, isn't it?
But it's also interesting because you see all these, and again, I think tattoos are fantastic, but you're just impregnating yourself with heavy metals, and all these health practitioners, or the having the tattoos, and it's like, hang on a minute. And, not only are they covering meridians and stuff like that, but you're actually putting metals permanently into your body,
I agree.
You can open up a can of worms whichever way. But hair mineral analysis, along with dentistry and your balances, is one way of a simple test. It might cost you, I think, 70 or 80 pounds as a way. Maybe this guy does it differently. I look forward to listening to that.
There is also something called the oligo scan.
Right, yes. You tell them about that.
Well, I've got one, and I haven't managed to get it going yet, because I haven't bought a laptop. Well, no, I bought a laptop the other week, so I need to get some training. But basically, if you know your blood group, then it's a little scanner that they put on your hand, and it can tell you what heavy metals you've got inside you and what minerals are deficient. That's from what I remember. So I bought this bit of kit, and I've had it for nearly a year now, and I haven't used it because I couldn't afford to buy a laptop at the time, but I've got one now.
Yeah. And that's the thing, is this is where we start moving away from the dentistry and more into the energy medicine, be it resonant medicine or resonance medicine, and you've got lots of people, I would think, in the PHA who are using kinesiology, machines to touch meridians and stuff. That to me is where medicine is going. I 100% agree. But you talk to a dentist about it, they glaze over and think you're absolutely crazy. And if you don't know, say, I don't know. I absolutely love energy medicine. I've had everything from Vega testing to other machines used on me for over 30 years. So yeah, embrace them and find a dentist who at least understands about the whole thing. Yeah, and there was a question here about teeth and meridians. For me, it's absolutely real.
Yeah.
We have, you know, auricular therapy, iridology, look at your palms, look at your feet, reflexology, every part of this wonderful body, which is self-healing, self-replicating machine. It's that ultimate robot, that ultimate nanobot that can fix and heal itself given the right environment. And there's so much information coming into the body and out all the time. Looking at your tongue, I had something in the paper, oh God, years ago, on looking at the tongue and tongue diagnosis. We have it all. And very simply, in my world, in my reality, you've got your teeth, which are related to meridians. And then the meridian that's unpaired is the tip of your tongue and the roof of your mouth. So every time you swallow, where your tongue should touch the roof of your mouth, you connect the energy and the energy flows through the body. At that point, the dental professionals say, John's lost it. He's absolutely crazy and cuckoo. But don't tell me a 5,000-year-old medicine that is becoming more and more popular. We can measure, we can visualize meridians now. You know, just because we don't understand doesn't mean we need to say it's not real. So swallowing right, and the basic, I like to leave teeth untouched. I choose not to drill teeth unless I absolutely have to, because your tooth is a crystal. And that crystal, when you bite into food, when you chew food, is creating energy that, guess what, for me, feeds into the meridians. And this is the whole issue. Maybe we're going to go into root canals. That root canal doesn't absorb the energy anymore. And we've then got to decide, is it better to have a tooth? Because every time you bite and chew on a tooth, it bends, it flexes, it creates its own little electrical charge, which feeds into the system, as well as the energy or the natural energy from the food we eat. So there's a load of questions on root canals. Can I just say my thing on it first? Every root canal filled tooth is infected. I recently had a ding-dong battle with some medical experts saying, oh, it's only colonized. Well, I do not know the difference between a colony of bacteria not doing any harm and in every other part of the body, bacteria living in there and saying it's an infection. In the gut, we invite bacteria in. I think maybe the bacteria run us, and I think that's where the modern thinking is coming. But bacteria live in teeth. They even live in healthy teeth. And those bacteria can do one of three things. They can produce toxins that leak into the body, and these are the endotoxins, the lipopolysaccharides and everything, and their waste products. They can sometimes shed into the body. And only last week I was on a webinar, they're saying up to 50% of the bacteria found in your blood come from a dental origin, because now we can DNA tag the bugs in your mouth and the bugs you take out of the blood. So all this thing is now going to oral systemic health. You know, as a dentist, we could never talk about the rest of the body because we were fixing teeth. But we now know the teeth are connected to the rest of the body. Well, some of us knew that, some of us still don't. And those bugs are getting into the body. And then because the tooth is dead, what effect does that have on our energy system? So putting the energy to one side, bacteria live in teeth. Marina and I have both chosen to have our root canal filled teeth taken out, but that's not.
Oh, I didn't have any root canal filled teeth. I just chose not to have mine done. Yeah. But as I said, my mum's got 2 root canals. She's 86 and she's been okay. And when I went with Dietrich Klinghardt, he actually showed us on patients using his form of kinesiology that you can have root filled teeth in the same mouth that are you might have one that is causing problems with the body and the other one isn't. Yeah. So I don't agree with having them all taken out unless you know for sure that there is an issue, because I think, you know, then you get into the realms of disturbing the bite, the posture, the breathing, and then you know, what do you replace it with? And again, that can be very expensive for patients.
Absolutely. So, you know, there are questions here saying, I've got a couple of root canal filled teeth, I'm 60, I'm reasonably healthy. Then it's a hard time to say, right, you should be having them taken out, you know, however many hundreds of pounds some dentists are charging now to take teeth out. And then you're spending 2, 3, 4 grand having implants put back in again. It has to be planned. Equally, if you come in with more serious health issues, then there is a time and a place to take out these extra focus of infections.
Agreed.
And from a dentist, we can have a look, we can assess the tooth. You know, mercury filling in a root filled teeth is even worse because the toxins, the mercaptins that are coming off root fillings due to their byproducts, mixing with mercury, make some nasty, nasty chemicals. But if you're fit and healthy and you don't have any other metals and stuff in your body, maybe there's a time and a place to leave them. I will root fill. I won't root fill, but I'll send a child to be root filled because taking a tooth out on a child who's fallen and bust a tooth is the right thing to do. But there's always a plan at a later date to change it. Now, this is where with the modern technology, which we're supposed to, or maybe not supposed to, you can take 3D x-rays. And with these 3D x-rays, you see things that you never used to see on 2D x-rays. But the thinking has to go forwards with this. And then when you go and see an energy medicine practitioner who will use kinesiology, which again, Marina and I have been trained in, energy medicine, whatever it is, but don't go with the dogma of all root filled teeth need to be taken out. It's specific to you as an individual. And if you have a root filled tooth taken out, you should be given all the choices and options, including all the costs. Nothing worse than seeing someone who's had a couple of root filled teeth taken out and suddenly realizing I've got to have a denture for the rest of my life, or I'm going to have to pay £8,000, £9,000 to have implants put in. It's got to be discussed up front, the same as having amalgams. Has to be discussed up front. It's the same as having splints. Has to be discussed up front. Your costs not now, next year, next 5 years, next 10 years. What is the cost of embarking on that care? And I've been guilty. I perhaps haven't got it right all the time, much to my problems, but it is that ongoing commitment and care. And sometimes less is more until you're sure you want to start on that journey. Now, I'm going to disappear for a minute while Marina's going to talk because I moved computers, I moved rooms, but I left my charger downstairs. So I'm disappearing for 1 minute, see how quickly I can come back. Marina, you talk about root canals.
Well, with root canals, I chose not to have one done. I chose to have my tooth extracted. But as John says, I get very upset when I hear people being told, oh, you've got a root canal, you need to get that out. It's so dangerous, because it might not be for them. Their bodies might be coping with it. Our bodies are absolutely amazing. And given the right circumstances, we can heal ourselves. And I think we should never forget that. And I find it really upsetting when people are told, oh, you might feel fine, but you've got this root canal and you really got to have your tooth extracted. Because the people that are telling you this are quite often, they have no idea what can happen if you have a tooth taken out and the consequences of not having it replaced, or if you do have it replaced. I've got a friend who's had a lot of treatment done. I've met several people who've had their amalgams removed. They've gone to clinics in Switzerland. They've had all their amalgams removed safely, their root canals removed, their cavitations done, and they've come back and they're sicker than ever. One lady remortgaged her house to go and have all this treatment done. I'm in contact with a lady in Germany who messaged me, and she said, I've been to this clinic in Switzerland and I know which one it is. It's very, it is a reputable clinic. And she had all this work done, spent thousands and thousands and thousands, and she's sicker than ever. So I've advised her to go and see an energy doctor that I know in Germany that might be able to help her. But, as John says, you've got to really understand the consequences of everything that you choose to have done, because your implant might not take your implant. And then what happens? You've spent all that money and the implant hasn't worked. That's happened to lots of people. So it isn't as simple as you've got a root filling, that's really bad for you, have it taken out. And the other thing is a lot of root-filled teeth become ankylosed to the bone. They just sort of stick to the bone. And then when you have them taken out, they're very difficult to take out. They splinter, and you have to have them taken out surgically, which means losing a bit more bone. So everything but everything has consequences, and you need to know what those consequences might be. And that is what is called informed consent.
Great advice.
So
Yeah.
I think it's interesting is that we'll go through phases of our dental care where, you know, when we're sort of 20s, 30s, we want that bright smile, that white smile, but realize that's for a lifetime. You know, there were dentists who would deliberately root fill teeth just so they could make a crown a little better. It looks fantastic. But fast forward 30 years, when we're now seeing the link between gum disease and root canals, which are the same infection. They're not a different infection. The bugs that are living in your gums that are causing health issues are also the same bugs that are living in the teeth, and probably the ones that are in your teeth are worse because they're not amenable for us getting them clean and healthy. And if we're now linking gum disease to diabetes, heart problems, stroke issues, certainly Alzheimer's and dementia are becoming targets to say, let's get your gums healthy, because again, we can tag the bugs in your gums to the bugs in your brain. And these are now associated links with these illnesses. So think about what you're having done now. If you want it for the here and now, that's absolutely fine. But accept that 30, 40 years down the line, you think, why did I ever do that in the first place? Stick with the balance. And I think Marina and I's focus has always been try and get the kids as good as we can, because as good as you can means less work going forwards, not, oh, I'll fake it when we're a bit older. And that's not to say people don't need work, but always give them the consequences of, if we do this, this could happen going forwards.
Yeah, absolutely. And I would say that, you know, I get asked a lot of people, how do I find a holistic dentist? And I'm going to be very controversial and honest here. I think a lot of them I wouldn't recommend, because I met a lady, I had quite a famous dress designer phone me up for just to have a chat with me. She'd been to see a biological dentist, and he did all the workup on her, and he told her that she had 5 root canals. 4 of them were fine, 1 was infected, but he said she needed all of them removing, and implants and cavitations, and gave her a treatment plan, I think, for £60,000. And she was absolutely horrified. And so was I, to be honest with you. And I also met a young lady who works in a shop in Cambridge, and she used to be a holistic dentist. She worked in a holistic practice, and she left dentistry, and she's retraining to do it's nutritional therapy, because the holistic practice she worked at were only interested in money. So be careful. The holistic dentists are not always the best dentists to see. You know, and I can say that hand on my heart, because I have nothing to gain, because I don't see patients, so you can't come and see me. And I don't do consultations. Just sometimes people ring me up. I don't charge anything, but I can't give advice because I'm not allowed to. But I can just give a bit of general advice. And all I would say is, don't just think you need to find a holistic dentist. They are not all what you think they might be. So, you know, use your intuition, and do what feels right to you, and make sure that whoever you see tells you everything. And that's why John's quite right. If you can teach, or you can talk to your normal dentist and maybe get them interested in joining something like the PHA, I think you've got a better chance. You know, I had to have a tooth taken out last year, and I went to see I had seen the same holistic dentist as that lady, and I was told, oh, you've got a couple of cavitations, and you've got to have those treated. I am really fit and well. Why would I want to go and have surgery that's going to be quite destructive, I think? And when I feel really well, and I look after myself. I detox every day. So I didn't feel I needed that treatment, and it was going to cost a lot of money. Then they wanted to give me intravenous vitamin C. That's another £300. And I've been sent treatment plans by patients, you know, who've been told, oh, you need to have vitamin C. Yeah, vitamin C is really great intravenously, but if you can't afford it, go and get liposomal vitamin C and build your body up with the liposomal vitamin C and take that every day. You know, that's the way, that's what we should be telling patients, not come in and have, you know, £300 worth of intravenous vitamin C. I'm sorry, I just find it all really upsetting when patients contact me and they tell me these stories.
But, you know, I think that's why webinars like this are so important, because what we have to do is empower people through this
Absolutely.
education so that they can go to the dentist and ask the questions. What do they need to be asking? You know, just giving people that kind of information empowers them and makes the dentist realize this isn't just a blank checkbook coming in. This patient
Absolutely.
understands the implication, and the onus is then on the dentist to justify what their recommendation is. But we've got to empower people in that way.
This is exactly why I, you know, do interviews like this, because I don't have anything to gain from it. I'm not in practice anymore, but I want patients to know what they can do to help themselves. And I think, you know, one thing that's really clean water, clean air, detox if you can, and get your gut healthy. And that will go a long way to helping with your oral health. I also think, you know, I get asked a lot about the anaesthetics, the graphene oxide. Is there graphene oxide in anaesthetics? And I've been sent, loads of people keep sending me videos and all sorts of questions. And to be honest, I had a tooth out last year, and I went to a dentist in Cambridge because I live near Cambridge. I decided not to go back to the biological dentist. I went to see a dentist in Cambridge, and I thought, you know what, I'm not even going to go down that route of graphene oxide because he'll probably think I'm bonkers. And I detox every day anyways, and I know it gets rid of the graphene oxide. But what I did do was I said to him, I need this tooth extracted. And he had a look and he said, yes. And I said, but I want you to use an anaesthetic without vasoconstrictor. So no adrenaline in it, because I wanted the blood to be able to flow as freely. And he said, oh, no, I can't do that because you might feel it. And I said, no, I won't feel it because the numbness will last long enough for you to take the tooth out. And he did as I asked, took the tooth out, was absolutely brilliant. And that was it. I trained him. I told him why. And he went away thinking about it.
Brilliant.
And you know, this whole thing about I get it all the time. Well, I don't want injections because well, you know, if they're going to put the graphene in anesthetics, we're all a lost cause because they'll be putting it everywhere. You know, someone, I think it was you, Marina, was saying they're putting it in certain bottled water. You know, we've got to hold our hands up. We've got to live in this big wide world. We've got to live with our eyes wide open, and we've got to do things for ourselves as to what we can do. And the first thing is to take control of our health, like we're trying to do with the PA. You know, if you can do better things and not say, oh, I want my mouth completely healthy, but I'm still on Wi-Fi and having tattoos and eating junk food some of the time because I like it. It's a balance of everything. And as we grow older, you know, I'm 65 now, I will do things now to look forward for my health going forwards that perhaps when I was 30, I wouldn't do. I wish I'd have started doing some of these things at 30, apart from the drinking alcohol.
Same here. I'm only 2 years behind you, John. I'm 64, and you know, I just think I'm in better health than I've been for years. But I go out and walk my dogs every day. I never wear sunscreen. I drink clean water. I use a distiller. You know, and I do what I can, and I eat as healthily as I can. And I do what I can to stay healthy, but I'm not obsessive. And that's the other thing. A lot of people get themselves so much in a place of fear. And fear is very stressful, and that does not do your body any good. You've got to remember, we are light beings, and we have an awful lot of power, and we can heal ourselves if we use the right tools.
Yeah, and the problem is there are those practitioners who work with fear. and
Yeah.
they do all the things that are wrong. And really, we are all, that's where I'm at. We're all condensed sunlight at the end of the day.
Yes.
We have so much power, and this is where it gets a bit weirdo and whatever. But it isn't. It's true. We all have that innate wisdom. Go with your gut feeling, and the science behind go with your gut feeling.
Yeah.
Find people who you can work with, and that's what the PHA is trying to do. And don't be an expert in everything. You've got to trust people and allow people that you can resonate with, because it's about resonance. It's about something. It is about building a family. And you know what? You will get disappointed by people, but you just have to learn from the lessons and move on. And you know, who thinks dentistry isn't a spiritual thing? It's an incredibly spiritual thing. For those of us who are really out there wanting to care, and rewards come in different ways, don't they? You know, I used to do something years ago. I would do laser surgery on babies with tongue ties. I don't do it anymore. Corporate dentistry and everything got in the way. The most rewarding thing I ever did was doing surgery on 2 and 3 day old babies so they could breastfeed. And it gave them an opportunity for the rest of their life to sleep, eat, breathe. It'll mean they'll snore less when they're older. They won't have metabolic diseases, possibly. Dentistry is such a profound thing to everyone. And, you know, there's a whole subject I'd love to go on to, but I'm going to sort of be a little bit cheeky and say, maybe we can come back again and talk about gums and gum disease and how all of that affects our health, because there are whole societies out there, certainly in America, on how gum disease affects us and our overall health. It doesn't give the quick fix. You've got to do the detox, as Marina's saying. But that in itself, there's all these components of dentistry, and we really are becoming dental physicians again. We're not wannabe doctors. I'm more than happy doing what I'm doing. I wouldn't want to be a doctor. I think to look at the whole body, I have a hard time just looking after 32 teeth and a bit of flabby tissue. But it is a gateway to health. We'd like to talk more about breathing and swallowing properly and how that influences sleep. And again, Marina and I think can do a good little job on that.
I think that's a great idea to do a bit more of a deep dive into some of these subjects. For sure, we can do that.
I mean,
and you know, even John, I mean, it begins in the womb, doesn't it? You know, when
before the womb.
Yeah. So educating from pre-birth to the end, you know.
You know, and yes, you'll get the patients who do the hair analysis to check that their body is chemically fine, but you've also got to look at the resonance and the reason, and dare I say, the EMFs that are influencing us all the time.
Absolutely.
Anyone who says that EMFs aren't influencing us is a little bit wrong. They're a lot wrong, actually. Anyone who says that chemtrails aren't real, well, sorry, they are, and you just don't know about it. So admit you don't know. There's lots of things I don't know. And what I will do is I'll go away and learn a little bit more. And Marina's been a great teacher to me, as has some of the other members of PHA. So I'm going to take this moment to say thank you, Lisa, for doing what you're doing. Happy 2nd birthday. Glad we can be part of the team. And I'm just going to give a big shout to, please, all of you people, put dentists in contact with me and Marina, and let's see if we can grow a group. And then I think we will take on the role with 1 or 2 other dentists on how to educate the next generation of dentists. I was with another dentist. He's going a very shamanic journey. Some people think it's a bit weird, but heavens, we've been shamans for a lot longer than we've been being dentists.
Absolutely.
You know? And it's find what fits you. Join what tribe you want to do. And if you want to join the fantastic smiles, white smiles, dare I say, the turkey teeth smiles, that's fine, because we'll always welcome you back again.
Thank you both so much. This has been fascinating, and we're already at an hour and a half in. I think we could keep going, couldn't we? So let's have another one.
Yeah, let's do it as bite-sized pieces, hey?
Absolutely. There's so much to take in. But you know, anybody that's watching now, if you're here to learn more, then this is the place to be. But if you're a medical practitioner please get on our directory, because we are looking for good people to help our members.
Local hubs. People don't need to travel to see me. They just need to find people in their own area who, even if they're not there yet, want to start that journey. And the nice thing about PHA, it's an unbiased group of people who just want to help, rather than...
We want to provide options.
Yeah.
In everything we do, we want to provide options. Whatever the malady is, there's more than one.
Yeah.
It's not one size fits all. So
absolutely.
Yeah.
Yeah.
Individual care with choices.
Yeah, absolutely. Thank you, guys.
Thank you.
Please join the practitioner directory if you are a dentist, a hygienist, a dental professional, and this resonates.
The people who are really great are the dental nurses, because they listen, and the patients talk to dental nurses. What's all this about homeopathy? What's all this about vitamin C? And the nurses empower the nurses. They can be a fantastic asset for us as dentists, and that great gateway between, you know, the silly, clever person here and the patient who really wants just simple how-tos.
Definitely. Okay, well, we look forward to the next one. We've got lots more to talk about. So keep looking at the groups if you're listening, and if you've any questions on the back of this, we will post in the description how to contact us and get your question through to John and Marina. So thank you, guys. It's been lovely to see you, and we'll speak soon.
Bye.